Paratuberculosis is found worldwide, especially on large-scale farms. It's called Jonas disease. The bacteria is Mycobacterium avian paratuberculosis. It's a gram-positive filament. It is also zeolnisin positive, and it's an obligate pathogen. It has very good resistance due to the large amount of lipids in its cell wall. It affects cattle mainly, but it can also affect sheep and goats. It is spread horizontally in the feces and the discharges, and it's shed asymptomatically before clinical signs occur. So calves that are infected before they're 6 months of age will have clinical signs when they're 2 or 5 years old. And calves that are infected after 6 months of age will be asymptomatic and they'll be able to shed the bacteria. The pathogenesis has 2 phases, the tuberculoid phase, which has no clinical signs, and then the lepromatous phase, which has clinical signs. So they get infected through feed and bedding and dust when they're under 6 months of age, and then they'll be shedding the bacteria. And then even when they're an adult, they'll still be shedding the bacteria. And then when the animal is put under a stressful situation, such as calving or transport, then the clinical signs will appear. The bacteria is in the small intestines and sometimes the large intestines. And it will then replicate and it'll attract cytokine, cellular and mononuclear cells. Then these cells get into the wall of the intestine and they cause severe thickening of the walls. This causes destruction of the intestinal follicle and it decreases absorption of nutrients, and it causes osmotic diarrhea and malnutrition. And the severe loss of protein causes edema. In the clinical signs, they only appear after 9 months old, usually around 2 to 5 years old. It is a chronic disease and they'll have decreased milk production and severe profuse watery diarrhea. And since they're excreting all the protein in the diarrhea, then they'll have severe edema as well. The animals will have severe weight loss and enlargement of the regional lymph nodes and proliferation of the intestinal wall. There is no treatment. For prevention, follow the normal epidemiological measures. And an attenuated vaccine and killed vaccine are only given to animals and herds that are free from TB for a very long time. This is because the vaccine can cause a positive TB test after the vaccine is administered. And for diagnosis, you can use PCR, IF. You can also isolate it, but it takes an incredibly long time. And you can also use ELISA, which only works later in the disease when diarrhea is present. Or you can do it earlier in the disease with paratuberculins.